Joseph Bledsoe, the MD advisor, and John Bender, MD, for Vend RX, reinventing the prescription experience.
A-
VendRx.net.
Actually, actually, it's going to be Dr. Elizabeth Louie,
Oh, yeah, welcome,
Vendorex.
Dr.
Go
Elizabeth
ahead.
Louie. Can you share your screen?
So I think Trent is going to share the screen. There we
Okay,
go.
we can see the scene.
Okay.
Okay, go ahead.
Okay. So VendRx, we are a company that is assisting physicians in dispensing from their office. Next slide. Next slide, Trent. So one of the issues that obviously we all know about in primary care and even in advanced care is that patients don't pick up their prescriptions, or they pick up the first one and they don't ever pick up the refills. They may or may not be using their medications, and it's really hard for us to track that. The insurance companies are trying to help us by sending us mail, and I don't know about you, but I get tons of this mail. So it may or may not be helpful. Next slide. So what causes that? I think we all know. Some of it is cost, some of it is patients can't get to the pharmacy, or they get to the pharmacy and it's a long line and they don't have time, or they just hate going. They just hate going and sitting there and waiting for prescriptions. Next slide. So somewhere between 28 and 31% of people never fill their prescriptions. And from the ER, it's a little over 30%. It's 35%, maybe just a little more, that they never pick up the prescription coming out of the ER that they were sent home with. Obviously, this causes significant bounce back and cost to the healthcare system, and frustration for the primary care physician. So the solution for this is to have the medications dispensed right in the office. And we all know that the problem with having sorry about that, having medications dispensed right at the office is that it's time consuming. And so that's the big solution here. Oh, that's the big solution here, is that this machine can dispense the medication. The patient can do it themselves. You send the prescription to the unit, and the patient goes, plugs in their name, their date of birth, and it pops up, and then they pay. Either they will pay cash if that's what they want to do, or they can pay with a credit card. And they are working on getting this thing set up so that it would be able to take insurance. Right now it is not. We're dealing with HIPAA and all of that, but eventually that will be. And so it doesn't really take us as physicians any more time to dispense right from the office, and then we can track directly from the homepage of the system. We can track whether they're picking up their meds, whether they aren't picking up their meds, and then whether or not they're using them, because if they're not refilling. So the case studies have shown that it is 93% effective in getting people to pick up their medications. In my office, it's 100% effective, because in my office, I have a very tiny office. I work in a very rural area. As I said earlier, the town has 352 people in it, and the nearest pharmacy is a half an hour to 40 minutes away. And so, but because of that, I can't put the machine in the waiting room because I don't have a big enough waiting room. So it's actually in the back. So I go with them to pick up their medication. And so I have 100% medication pickup rate, but overall it's a 93%. Next slide. Patients love it. Right now, many patients are having to pay, or we don't have to, but many patients are paying cash, and they don't care. In my office, I don't charge anything extra. I charge what it costs me to get the medication, and I use it because I wanted it to draw patients in. And I started this practice just 2 years ago, and so I was using it as a way to draw patients in. And they will pay to not go to the pharmacy. They would rather pay the $6, $7, $8 than go to the pharmacy. So we have much improved patient adherence, and of course, much better health on the side of the patient, because they're using their medications more effectively because they don't feel like it's a big nuisance to go pick it up at the pharmacy. From my end, because I can track patient adherence much easier than wading through the various insurance companies' lists of who's picking up what. In addition to that, you could, and many practices do, charge a little bit more than cost for the medication, and then it's an income source. And some practices have had a huge increase in revenue with that. So you write from your EMR, you write the prescription, you e-scribe it to the VendRx machine. And as I said earlier, the patient goes out and puts in their name. And when they put in their name, up pops their prescription, and it asks them if they want to pay cash or not pay cash, or they can swipe their credit card. And they swipe their credit card and they go. And so it doesn't take me any extra time, well, because I have to write that script and send it to a pharmacy somewhere. And so it doesn't take any extra time, which is huge for, I know, all of us. We get the medications from any of several companies. You can pick which company you want. The VendRx will tell you which ones seem to have the best deals on the medication. And you can see here in the left side of this screen, the guy is putting the medications in, and you push the button and the machine, the little arm there, you can see it in the middle screen, reaches around, grabs the medications and stocks them in the machine. The one I have right now, I can stock, I believe it's just over 800 medications, different bottles. The bottles are all prepackaged. There's no counting medications. So for my practice, we tracked for about 6 months which prescriptions we used the most. And then those were the ones that we ordered and put into the machine. And that was all done through the VendRx company. They helped me with that. So I load the machine at night so that it doesn't slow me down during the day. They do have other newer options now. So the one in the top left corner is the one I have. It's a very large, sturdy machine. I dare somebody to try to break into it without a jaws of life. They now have a smaller version that the patient would go and plug in all their information, and they would get a little slip with a number on it, and they would then take that to the staff in the office, and then the staff would dispense the medication directly. And for smaller offices like mine, that might be a better option. They are you know what your inventory is at any given time by going to the website, to the VendRx website. There is a web app that is going to be up and going, and there will be mailing label print options so that the medications could actually be mailed to the patients, so they could have their own mail order pharmacy direct from the provider rather than from some company, 3,000 miles away. Next slide. So for me, in my practice, it's rural, it's a long way, and for a lot of my patients, it is the only way for them to get their medication, and they don't mind paying, as I say, $6, $7, $8. Now, if it's a $150 medication and their insurance will only be $5, that's a different story, but those kinds of medications I don't keep in the machine because people can't do that. On the other hand, for some of these medications, it's actually cheaper for them to pay for it through the VendRx company than it is to pay their copay. So for some of my patients, the copay for things like amoxicillin is $8. Well, it's $4 in the office, and that's my cost. Again, I'm not making any money on it, but many people have charged just $1 or $2 more per prescription and actually have an income source.
You have 1 minute.
So from my perspective, it has been a very handy machine. It has done exactly what I wanted it to do, which is brought patients in because they feel that it's so convenient. And if they have a problem with the medication, they feel like they can come and talk to me and not have to wade their way past the pharmacist and the line at the pharmacy to do so. So I have seen huge increases in compliance with medical therapy. And I've had really essentially no problems. And I will say that when I do have a problem, the VendRx team has been on it instantly.